What's the best way to approach chronic joint pain? Hi, I'm Chris Masterjohn, and I have a PhD in nutritional sciences. I am not a medical doctor, and nothing contained in this episode may be construed as medical or nutritional advice of any kind, or a substitute therefore. This episode is meant purely as scientific education. If you wish to act on any ideas presented in this episode, please consult your physician first, and never take anything herein as a reason to contradict medical advice. With that said, enjoy the episode.
Kate Miller asks, is there a real difference between taking undenatured collagen versus denatured collagen, or is this marketing scheme? What advice can I give a 34-year-old male who has pretty bad joint pain? Kate, I think that the collagen thing is very much up to an individual person's digestion. So, for example, I have some friends and clients who do very well with Thrive Market and Vital Choice collagen, but they don't do well with other collagen brands. And it's because, or we believe it's because I think the difference is a low temperature enzymatic digestion used by those companies and a more high temperature process used by other companies that seems to break the peptides down in a different way that favors some people getting digestive problems from the processes that use more heat. And I think that sometimes the same can be true from gelatin. So, and then of course, if you have incomplete digestion of the gelatin, you might have a less good of a response to the collagen peptides. But that said, the only study that I know that was done for joint health on this topic was a study by Keith Barr that actually used gelatin, not collagen peptides. And what they found was if you had 15 grams but not 5 grams of gelatin, and you combine that with 50 milligrams of vitamin C 30 minutes before you did exercise, the exercise helped drive the collagen peptides into the joints, and the joints used it to increase their own collagen synthesis. And so the principles are, you might need a little bit of vitamin C. I mean, probably you don't need, I don't know if the vitamin C is needed. They put it in there. They put it in there because vitamin C helps collagen synthesis. But the key finding is that those collagen peptides are not going to disproportionately get into the joints, and they might not even get into the joints that effectively when you take them at rest. You take them 30 minutes before exercise, the blood levels are peaking when you're doing the exercise, and the exercise increases the circulation of fluid through the joints, which transmits those or transports those peptides into the joints. In terms of other advice for joint pain, number one, movement. I think a sedentary lifestyle is absolutely terrible for joints. Any movement is better than no movement, but a mix of like endurance cardio work at a moderate pace with maybe a little bit of high intensity exercise per week and a little bit of weightlifting would all be, would probably be the ideal mix of movement. And then work with a physical therapist. I think the best thing to do is look for someone who has a doctorate in physical therapy who works with athletes. Generally, I think physical therapists who are working with athletes and who are charging money out of pocket and not working with insurance are the best people to work with from the standpoint of optimizing form and function, whereas someone in a more conventional physical therapy route is much better suited to short-term treatment for an acute injury. And so I think with someone with a chronic joint pain issue, they want to do the former. They want the DPT who works with athletes and takes cash payments, not insurance. And I realize that is expensive, but the thing is, when you're taking insurance payments and you're claiming to do medical treatment, you put yourself in all kinds of regulations that are well-intentioned, probably, to try to, from an ethical perspective, prevent physical therapists from preying on people by locking them into endless treatment. But the practical result result of those regulations is that they just don't work for treating a chronic issue. Because they incentivize or even force the physical therapist to claim you got better and send you off on your way, as opposed to constantly analyzing how you move and what you can do to move better to put less stress on your joints. And then I think the last thing would probably be look at inflammatory foods. If this person is eating a lot of obvious culprits like wheat and dairy, and I say that as someone who actually eats a lot of wheat and dairy, but if someone has unexplained joint pain and they're eating a lot of wheat and dairy, or they're eating a lot of soy, or they're eating a lot of common allergens or nightshades, you could just do a trial and error experiment to try to see what are the foods that person reacts to most. You could also do like a Cyrex array to look for what the person might be reacting to with their immune system. Although I think even with those, you can't overinterpret that test. You have to use it as a basis for trial and error testing. So if what you would do for trial and error testing to try to remove inflammatory foods is obvious, then you can just act on the obvious suggestions that you could make. But if you feel stuck in a rut and you're not sure what to test, or your trial and error testing that you do doesn't work, then you might want to go for like a Cyrex array to look at what are the things you might not be thinking of that the person might be reacting to. But you could look at the thing is, it might be an immunological thing, or it might be by immunological I mean an antibody thing, but it might be just like a mast cell degranulation thing, or it might be like a gut metabolism of sulfur amino acids into sulfite that then downstream from that degranulates mast cells and releases histamine. So there's a lot of different things to look at for what foods might be inflammatory triggers, and I think that's a difficult question and one that requires a lot of trial and error and possibly a lot of continually coming back to the drawing board to look for the next hypothesis if the first one doesn't work. But that can be important. So in some, I think any of these collagen or gelatin supplements, 15-gram doses with a little bit of vitamin C 30 minutes before a workout, a mix of movement, of some endurance-based cardio, such as 30 minutes on an elliptical or 30 minutes of swimming. You definitely want to move the joints that are affected, right? So I have a lot of head and neck tension. I need to do the elliptical that has arm movements because it gets the thoracic rotation in this area that is where one of the major places of tightness is. Swimming would also be able to move those joints around a lot, but doing a bicycle with no arms is not going to do anything for that area, right? So the movement must target the joints that are affected, and you definitely want like 30 minutes a day of just moderate movement. Even walking would be great. But then you also want movement aimed at actually, supporting the muscles and the proper joint motions and stuff like that. And so that's where weightlifting comes in. And then you definitely want some guidance from a physical therapist who works with athletes at a minimum to guide the form on the weightlifting movements to make sure they're supportive of the joints instead of make them worse. And then eat a nutritious diet and look for inflammatory foods and try to cut them out and see if that improves it. So that's how I would look at that. Thank you, Kate, for your question.
This episode was part of a Q&A for members of the CMJ Masterpass, a buyer's club with exclusive and massive discounts on your favorite premium foods and health products, including pasture-raised and wild meat and seafood, supplements, sleep accessories, water filters, phototherapy devices, and much more. As a bonus, you also get to participate in monthly private Zoom Q&As with me. You can join the Masterpass at chrismasterjohnphd.com/masterpass and use the code Q&A, spelled out as Q-A-N-D-A, Q&A, for a 10% lifetime discount. For the remainder of 2020, I will be working full-time on finishing my Vitamins and Minerals 101 book while reserving a portion of my time for consulting clients. You can pre-order my book at chrismasterjohnphd.com/book. In my consulting, I am neither a medical practitioner nor a coach. I serve as your data analyst and your strategist. I teach you scientific principles of health and wellness, help you analyze your data, and help brainstorm actionable strategies. You can sign up for a consultation at chrismasterjohnphd.com/consultations. I will try to respond to comments here when I can, but my presence will be intermittent while I'm finishing my book. I hope you enjoyed this, and I will see you in the next episode.